And thank you again for joining us here on PM Express. Tonight, we are focusing on our heroes, the frontline health workers who are putting their lives at risk so we can all survive the coronavirus pandemic. And we are focusing on the work that you're doing across the country. We want to show appreciation to them for the gallant men and women in the front line currently, the nurses, the doctors, the lab technicians, every single individual who is putting his or her life at risk tonight to help this country through this difficult time. We want to spend this 1 hour understanding what you do and celebrating your work. And that is why we're looking at this particular big conversation about containing the COVID-19 pandemic. We're going to assess the safety of our frontline health workers. Let's start with the very latest on the COVID-19, shall we? We know that the COVID-19 confirmed cases stands now at 53. It was 52 in the afternoon, and just a few 1 hour or so back, it was updated. One more case has been added to it, bringing us to 53. So that's the very latest on this particular development with the confirmed cases. The health professionals, the government today at the press conference told us all that we can expect more cases in the coming weeks and months as a result of the curve that we've seen across the globe. We haven't seen the worst yet, but of course, don't panic. Be calm about it, because it's just what the pandemic does, and that's why all the measures have been put in place to try and deal with this particular issue with the coronavirus. So that's where we are with 53 cases. Now, 2 people out of the 53 we know have succumbed to the disease, to the virus, and have died as a result of this. We know that for now. We also know that 25 of the 185 of the we know that 25 of 185 out of the 1,030 returnees have tested positive. This is a startling figure. Now, let me break this down, but let me explain this. So currently, there are 1,030 returnees. These individuals came into Ghana between Saturday and Sunday midnight. That period, the president had announced that Ghana was shutting its borders, land, sea. Now, everybody who came in within that gap, right, was quarantined, mandatory quarantine. That number is the 1,030. So they are in mandatory quarantine. Nobody's saying that they are positive, but we don't want to find out later that they are. And the possibility that they may have spread the virus. So put them in a location where they will not be in a position to mingle with anybody else but themselves. We know that these 1,030 have been put in hotels across the capital. Now, out of that total number, the health officials tested 185 of the number. Now, they're doing more testing, but that's the number they've tested so far. Out of that figure, 25 tested positive for the COVID-19. That's where we are with that tonight. Now, we also know tonight that the remaining 845 are yet to be tested and results released. We'll get to know that in the coming days, definitely. Now, the immigration has assured that they are also doing their best to ensure safety at the various borders. And in fact, we've seen today at the press conference that they've made some arrests at the border. People are trying to smuggle individuals into the country. The 8 other MPs we know, and this is the thing about COVID-19, is that it is the ultimate leveler. It does not know race. It knows no age, no status in society. And so 8 MPs have been asked to go into mandatory quarantine after returning from trips abroad. In fact, the Speaker has written to these MPs asking them to stay away from the House. And so this is not just a plea to them. It is being enforced by the Speaker of the House. We know Mahama Yariga is one of them, one of those affected. Now, Parliament has also in the last few hours directed all non-essential staff to go home indefinitely. I mean, that is a sign of the times indeed. Now, we also know that in the wake of the coronavirus, there have been many concerns. There are calls tonight and growing calls in the wake of the 100% spike in our confirmed cases, the numbers of confirmed cases. It was 27 last night when we're doing this show. Last night was 27. Tonight, it is 53, 100% jump. In the wake of that, calls for a lockdown is intensifying. We'll speak to the frontline workers. They are there. They're putting their lives at risk. What they make of that call, whether they agree that we should have that shortly. But we see many people say this. And this is across a political divide, by the way. We have the, I think, Central MP, Kennedy Japan, MPP Member of Parliament, making the call for a partial and eventual total lockdown. The minority team in Parliament, minority members of Parliament are also calling, they are calling for a total lockdown. We've heard tonight from the former Health Minister, Joseph Yilitra, and a deputy ranking on the Foreign Affairs Committee, also former Mayor of Greater Accra, Mr. Van der Poy, also call for a total lockdown. Noguchi Memorial Institute have also made a pronouncement on this. The director of the institute have said tonight that in the next 1 or 2 weeks will be critical for government, and government will need to make a decision whether or not to impose a lockdown on this particular country. That's a decision that government says they will make as they review the situation going forward. The Interior Minister, though, is dismissing calls for a total lockdown. He believes that the measure that government is taking is enough, and as of now, there isn't a basis yet. Some scientists agree that we are not there yet, and that it will take a lot more data to isolate areas where the focus is. Then we can make a decision on what to do and who and where to lock down. So it's still something that is pretty fluid. We'll come to explain that shortly. Now, there are fears, though, that the country's inadequate health resources cannot contain the scathing numbers of the confirmed cases. Another key thing that the concern has been, and we are not sure of adequate protection for frontline health workers either. Listen, no country has enough for frontline workers. Italy now is getting medical aid from Russia and from Cuba. Yes, Italy, far advanced than Ghana could. They're getting medical aid. In fact, in the US, doctors are being asked to reuse PPEs. PPEs, you use it once, you dispose of. In the the richest country, most powerful country in the world, doctors are being asked, after taking care of coronavirus patients, to reuse the protective clothing unheard of. And so you can imagine that in Ghana, a poor country like us, what will happen to our health frontline workers? That is why we need to celebrate them even more, because of the peculiar situation we are in. If US, Italy, and elsewhere are struggling with this, with the frontline health workers, you know where we are heading as far as this is concerned. And so tonight, we're going to be assessing the safety of our frontline workers and also celebrating them. Join us as they join us for a conversation. And thank you for staying with us here on PM Express. I am excited to announce that I've just been joined in the studio by Dr. Winfred Ba. He is the medical doctor, Kolebu Teaching Hospital, also the Greater Accra Divisional Secretary of the Ghana Medical Association. He is in the front line of fighting the COVID-19. Also joining me on live view. And I must explain why he's joining me on live view. We're trying to observe the social distancing. And so although we could have him in the studio, our space isn't accommodating and safely, but really we have to observe the rules of the health profession as they've advised on this matter. And so Joseph Krampa is joining us via live view. And as you can see, the Nurses and National PRO Ghana Registered Nurses and Midwives Association. Hello, Joseph. Thank you for joining us. And we are grateful that you could make time to speak to us. Yes, he is in our building, but we are just observing the strict social distancing measures. You will hear him. He is representing the nurses. He's a nurse himself. You can't have this conversation without them, and we are grateful that he could join us. Also joining me on the telephone right now is Dr. Bernard Abegu Hammond. He's the president of the Ghana Association of Doctors in Residency, and I'm grateful that he's also joining me. He's also in the front line of this particular fight. I'm also delighted to say that I've also been joined, will be joined by Dr. Ignatius Awini Bunu. He is the president of the Ghana Association of Medical Lab Scientists. Remember that they do the testing for you. They actually do the test. They take the swipe and they put it in the system. I don't know how they do it, and they tell us whether it's positive or negative. They're putting your lives at risk too. And so we want to acknowledge all of them, and thank you very much, gentlemen, for joining us here on PM Express. I want to start with the nurse, by the way, before I even come to the doctor. And Joseph Krampa is obviously joining us on live view. Joseph, thank you for joining me again. What is life like for a nurse on the front line of this war?
Thank you. Could you come again, sir?
I mean, what is life like for
Could you
a
come
nurse?
again, sir?
What is life like for a nurse on the front line of this war?
Actually, there is agitation on the ground. Nurses and midwives, as frontliners, are not taking things easy based on so many factors. So I can say that all is not well with us as nurses and midwives in the country.
And the beauty of this, we'll come to the challenges shortly, but the beauty of this is, yes, you have challenges, but you're having down tools. You're still working in the trenches against an invisible enemy.
Yes, for the nurse and the midwives, I think we are trained to actually intervene in such situations, I mean, any infection or any illness of any kind. So we are poised to do what we can do to actually help contain the situation the country is facing. Not only Ghana, but even the whole world is facing now. And so we are ready to actually work.
That is very encouraging. I like the sound of that. It actually gives me a chills. We are ready to do the work. And that the trying circumstances that we all find ourselves in, unpredictable what this particular virus is. We're still learning about it. Tell me, because you are you are a nurse yourself, are you not?
Yeah, I am.
Good. So in your facility where you work, I mean, share with me how you work now with the virus lurking around. Have you dealt with a patient or a suspected case before? Just share with me what it is like now to be a nurse.
All right. Actually, the nurse have been trained on the infection prevention and control, and therefore, if anything that comes your way, which actually requires your duty as a nurse or midwife to take care and to protect yourself, actually you had it in training. But coming to this particular COVID-19, this is a new actually disease or infection that we are facing. And it has been some kind of first time that we are actually confronted with such a situation. So it hasn't been easy at my facility. There are certain things that we need to put in place, and some that we are even expecting, yet we are still there helping the way we can to help our people who come for health services wherever we are. It has not been easy, but we are on our toes.
This is before I come to Doc and my other guests on the line. Have you ever dealt with, in the last few weeks, personally, have you dealt with a suspected case or a confirmed case? Slight delay there. We'll try and reduce that time lag shortly. But let me come to the studio, Dr. Winfred Barr.
Hello.
You obviously at Kolebu Teaching Hospital, biggest facility, premier hospital. What's it like on the front line?
Well, thank you very much. I think, like he said, doctors and the nurses are prepared to work. We know we are at war. So when it comes to the military, the soldiers are there, they go with their munitions. Now we are fighting an enemy we can't see, but we are very ready for it. But you know, just like a military man, when you are going for war, you have to be well equipped. And so the only concern our people have is having the appropriate PPEs. That is what protects you.
Personal
protective equipment. Okay, being gloves, the goggles, the nose masks, the face shield, and all of them, the coverall and the rest. There are appropriate PPEs for different procedures. And once our people have this, they get more confident. I mean, monitoring all our platforms and everything, I can see people are really ready to work.
They are.
People are really ready to work. And as we are speaking now, we have doctors and nurses on the front line. All the cases we have, our people are managing them. You know, they've started it. We've started the work. We are doing it. But as we all know, the cases are going to increase. It will get to a peak and then it will come down. It means that we are going to need more people on board. So for now, people are not complaining much because, yes, there are a few PPEs in town. But what about when the numbers escalate? Then that's when we are going to have the issues. So our people are really ready to work, but they just want to be safe.
Here's the thing that I'm curious about, and I have a doctor here and a nurse. I can ask this. Anytime I watch the news, every case that walks into your facility, I'm sure you consult. So people come to you, consulting room. You have a consulting room every day in Korle Bu, right?
Yes.
Somebody might come to you with something else.
Yes.
But might show symptoms that maybe cough. Look, I sit here. A colleague of mine cough, and I'm wondering what it is. But here you are in the hospital. That's where everybody sick goes. I'm just curious. Are you treating every patient now who walks into your office as a potential case, and therefore you're protecting yourself? I mean, the risk is so huge because you don't know who and what he's carrying, and how are you managing that?
Yeah, so that's true because, you know, people who do not even show symptoms can spread the disease.
Absolutely.
So it means that once you see somebody, you have to look at it like, this is a potential case until proven otherwise. So what we are doing now is to do what we call pre-triaging and then triaging before they see a doctor.
Explain that.
So what we are doing, for example, in Korle Bu, when you come there for any other reason, for any reason at all, there's somebody on the front line doing the pre-triaging. So we'll ask you, do you cough? Are you coughing? So it starts at the distance. Do you cough? Do you have fever? Have you traveled to any of those countries?
But
or have you
that
is
case
changing.
Definition has
that
changed.
Is changing.
Yes.
Or have you been in contact with somebody? So we ask those questions. If any of them is positive, they just put you somewhere and they say, wait, then another person will come as the triage area. They will also be in the some nose masks and the appropriate PPE.
That is, if you answer yes to the question.
Yes, to any of those. If it's no, which is still dangerous, though, you still have to go through the system to check your temperature and everything.
But the person might not show any temperature.
That's the danger. So they do the pre-triaging and the triaging before they go to the doctors. But even that, sometimes they get to the doctors, and then you begin to ask other questions, then you realize this is a suspected case. So if we don't do the pre-triaging and the triaging, you end up spreading it before you. And there have been instances where people, in fact, sometimes people were even dying because they suspected, no, this could be one.
The person was dying.
Yes.
Can you imagine how many people
So you could imagine how many people would have been exposed. And that is the danger about this. So how do we go around this? We do a good pre-triaging and triaging, but also to make sure that the health workers are well protected.
Yeah.
That is the main thing.
In fact, I want to focus a bit more on the protection because for me that's really the key.
Yes.
We are celebrating you, but the system must give you the tools and the weapons you need to win the war. So we'll talk about that next time. I'm just baffled by what you described. I mean, have you had a scare yourself?
Well, not really, but yeah, the system had a scare.
A scare, and I remember. I mean,
You remember
there's
we
been
were
a few.
here.
There's been a
Yes.
few, yeah,
Yes.
in the
Yes.
thing. So walk me through. You wake up in the morning, you go to Kolebu. Normally, you take it for granted before Corona.
Exactly.
You take it for granted.
Exactly.
Do you take it for granted that you go into the office anymore?
Not at all. And that's the advice we want to give all health workers. Now, when you go, we have to observe strictly the infection prevention techniques.
What are those?
So, ideally, when you get to the hospital, you need to wash your hands, use the sanitizer. Now, it's advisable that you get what we call scrubs.
What's that?
Because you see, the scrubs, those are the uniforms, like those
The white
in
ones
theater,
that you wear.
blue, like the ones people wear in theater and things. So you can also wear them on the wall. So we have scrubs that we use. So you go home, so you come to work, change into your scrubs, you go and do your work, observe all the preventive measures, the distancing, using the appropriate face mask when you have to get close to a patient. When you close, come back, disinfect, change into your house dress, and then you go home because you have children at home, you have a wife, you have family at home. If you don't take care, you can transfer the infection to your house. The same people will go to school or go somewhere and also spread it. So protecting the health worker is very important, because if one health worker gets it, and don't forget that the same person will also go and see other patients who come for, let's say, just diabetes management, hypertension, or malaria or something. And so protecting the health worker is very important if we want to protect the whole population.
I want to bring in Dr. Bernard Abeku Hammond. He is the president of the Ghana Association of Doctors in Residency. Hello, Dr. Hammond.
Hello, Evan.
Hi, thank you for joining me. Please explain to me, doctors in residency, what do you do?
So we are the group of doctors who are undergoing specialty training to become specialists to manage specialized cases. So you have people training to be surgeons, do surgeries, people trained to take care of children as the pediatricians, people who are take care of pregnant women and women health as obstetricians and the gynecologists. You have people, doctors who are also going further training, so we call that postgraduate training. So these are there are a variety of programs that are run at various training centers in this country. So this is a very wide group. Usually the training may take between 3 to 6 years to complete, depending on which specialty and how, whether even you want to subspecialize. So this is a very unique group of people, and we are really the frontline doctors, because together with other colleagues, our house officers, our medical officers, we form the frontline doctors who attend to every case that come into any hospital. Then we may consult our senior colleagues for their input, and management will continue.
So how is the war so far on the front line?
Well, it's been hectic because, as you rightly noted, the proper attire that we are supposed to don for this war is more often than not available. You are partially clothed for most of the time, because there's a pandemic that is sweeping across the world. And for us in the hospital, we have been insisting that the hospital really is a very dangerous place to be. As my senior colleague, Dr. Ban, has just formed a typical day that he goes to in Kolebu, the same in every other hospital in this country. You come in not knowing who you are going to meet. There are people who may come in with COVID-19 symptoms. These are symptomatic. There are also people who come in, they came in with other conditions, totally unrelated, but they may be asymptomatic, but they have been exposed somewhere, they may be carriers. So you come in not totally, you don't know what to expect. Therefore, it's only right that you should be prepared, knowing whoever patient that you are going to meet. There has to be some sort of protection for the frontline health workers. And as you also said, it's important because for instance, if you have any health worker that is exposed, that means that that person also has to go to isolation. One, you've lost someone who could have been on the front line in the battle against COVID-19. You've lost someone. If that person also was exposed to other people, he has also carried the infection across. So you can imagine, I see this patient move around, I see another patient, not knowing this patient has already exposed me. I've also opened myself up, gotten exposed subsequent patients. So it's really, really important for the health worker to be protected.
Yeah, I mean, Dr. Ba, let's talk about the protection now. He's raised it, the nurse had raised it, you also touched it. So let's deal with it. He says it's not enough what you have. Like, I want to start with the basics, right? Do you have enough gloves for one, and face mask? I mean, I'll go to the real one shortly, but this is the very basic ones. Is that available in enough quantities for you?
Well, for now, I think gloves and face masks are available.
Okay.
But like I said, it's about the numbers.
Okay.
And we are expecting that the numbers will be increasing.
Yeah.
So we'll be needing more people in the front line.
Yeah.
So there will be increased demand for these face masks and all of that. So we can't say it's enough now.
Yeah.
For now, what we have to work, yes, is there, but we can't say it's enough. And we should know that there's a global shortage
of it. Everybody else is looking for it.
Everybody else is looking for it.
In fact, not only healthcare professionals, ordinary people are looking for it.
Yes.
You're competing now with all of us. I have a box of gloves in my home with face masks, etc.
Exactly.
So that means one box short for you who need it.
Exactly.
In the
and
hospital.
That's why we have to get in now, or the authorities have to get in, make sure that it's available for healthcare. For example, in Italy, what they are doing now, they are calling on, this N95, some industrial workers also use it. Now they are saying, don't request for it again. We want to make them available for health workers. There must be some policy directions in that line to make sure they are available. Because you see, like we said, if like Italy right now, the doctors are overwhelmed. When the doctors are overwhelmed, what happens is that sometimes some of them work like 12 hours, 24 hours continuous.
Yeah, I heard a story on BBC. Yeah. One of the doctors says you can't even take a toilet break.
No, because the patients are just coming in.
Yeah.
And when you do that, they get fatigued. When you get fatigued, you start making mistakes. Yeah. When you start making mistakes, that's when you can easily
in the face of this virus,
yes.
you can't afford to make
mistakes. You can't afford to make a mistake.
You put yourself and the patient
at risk. At risk. You see. So we need to, and that will be that's the time when we will need the PPEs and all of that.
So let's talk about the PPEs.
Yes.
So obviously, mask, gloves have enough now, but of course, as the prediction goes across the globe, we expect this to peak. Yeah. And so once it peaks, pressure comes on the healthcare system. And so this is the time, if government has to hoard basic mask and gloves for health workers, they have to do it now.
We have to do that.
Let's talk about PPEs. The president announced over the weekend when he did the address that they've ordered more, but you are with the biggest health facility. Do you have enough?
I don't think so. I don't think we have enough, at least from what I have seen and from what others say. We are told that some have been ordered. Today I read the news that the Pentecost Church has donated some to the ministry. So we are hoping that a lot more is coming. But for now, when you ask, they will tell you what we have is not enough, so we have to use it judiciously.
When they say judiciously, what do they mean?
So it's like when it's really needed, then we use it. But you see, those ones can also compromise health workers in a way, So we need to get enough. Other countries are pushing to manufacture it themselves. This is the time when our companies, our businessmen can take advantage and see Aprotec, see what we can do. People are using plastic rubber and they are making things out of them.
In Italy, they're being so terrible. They're using garbage bags, really, to design.
I think our industries can look at how they can help. Now, I've heard of some of the universities producing the hand sanitizers and things. these are very good things to do. We have to wake up to the challenge. This fight is for everybody.
Yeah.
We are the frontliners, but everybody must be part of this fight.
So interesting. So for the doctors, you say you're not enough protection with the PPEs to go into this fight.
Yes.
Okay. I want to bring in the nurse, Joseph Krampa, who's obviously with us on live view. Joseph, earlier you wanted to talk about it. Let me get your assessment of nurses. Nurses assist the doctors in the wards. The doctors say they don't have enough PPEs. I wonder what the story from a nurse's point of view is when it comes to protection for this war. What is the status of that?
Thank you very much. For nurses, I think and midwives, excuse me, we form the largest, in the largest number of, let's say, health workers in the sector. For instance, if there is one doctor, just imagine how many nurses or midwives we have working with the doctor. So even if the doctor is saying that now he is overwhelmed, then we can imagine the size of the nurses and midwives who even check the vital signs of people who walk in, check their other things before even these people will go and see the doctor. Mm-hmm. So it is a very big challenge. We are overwhelmed. And as Dr. Ban rightly put it, the PPEs are not adequate. Even as at now that we have not got to the outblown level, we can see that it is not all the facilities, especially in the hinterlands, where I am working, for instance.
Where do you work? Where do you work?
And so I work in the German North Sumahinkro Health Center, to be precise.
Goodness me.
We share border with the Ivory Coast, and that place we don't have approved routes, but people walk from the Ivory Coast and come directly for health services at our place. Sampa is our district capital, which has an approved route and which has been closed down or locked down or shut down. So you will see that people may not pass through Sampa.
Do you have
PPE
at your workstation where you are in German? Do you have?
Yes, like I said, we have few which are not adequate.
Okay.
Compared to people who come for services. If we are to use them anyhow, there will be a problem. And if we don't, we may not be able also to protect ourselves. So we are in a dilemma.
What is the protocol? What is the protocol right now for the use of the PPE where you are?
Yeah, with us here, what we're taking through was that those of us, especially the nurses at the vital centers, who are the first point of call where patients come for us to check their vital signs, we need to put on these masks and let's say other gloves and others before getting nearer to them. And one major challenge is that it's not all such facilities that have these infrared thermometers, which we are asked to actually distance ourselves about 1 or 1.5 meters from a patient before we take these temperatures and others. Some of the facilities are still using the old one we put in people's armpits and whatever. Goodness. So for you to be nearer the person to take their temperature, it means that idea of 1 meter between you and that patient is greatly reduced. So we need to be using the mask and other things to actually protect ourselves for any potential infection that may come our way. And once these gadgets are not many, then it means we may run out at any time, and that will not augur well for the health workers.
I want to quickly.
So it's a very big problem.
It is. I want to bring in Dr. Ignatius Awinibono, who is joining us. He's the president of the Ghana Association of Medical Life Scientists. He's joining us via Skype. Doc Ignatius, thank you very much for making time to join us. I mean, laboratory scientists are important. And on this front line against the coronavirus, which is an invisible enemy, what is the role of the lab scientists?
Thank you very much, Evans, for the opportunity to share some thoughts on this. I'm particularly happy that your media outfit has recognized us as key members of the healthcare team. Most of the time, when the healthcare team is mentioned, the lab scientist is virtually forgotten. But the lab scientist has a very critical role. First of all, in this outbreak, you would agree with me that the lab scientists play three critical roles. One is in the sample collection, and that means when there's a suspected situation, it will be the responsibility of a licensed lab scientist to move, interact with the patient, collect all the relevant samples from the pharyngeal regions and also from blood samples for testing. It is also the duty of the lab scientist to properly package this, considering biosecurity measures. It is also the duty of the lab scientist to ensure that the transport of these samples get to the designated laboratory for testing. Now, when you get to the laboratory, you have the duty of also your colleagues there helping to do the testing. In all these steps, we are exposed to a lot of risk. First of all, you would want to imagine if the patient at the point of collection coughs or sneezes onto you, you are already exposed. If in the process of managing the specimen, it is not packaged properly and it pours, you are also exposed. In the transport process, you are also exposed. Now, when you come into the laboratory properly, the working conditions may require you to do a number of processes, including the centrifugation. That means you subject the sample to high-speed rotation that would ensure that you separate before you can have your relevant segments of the sample to work with. These all require biosecurity measures. In the laboratory, you need what you call the biosafety laboratory, level 1, level 2, level 3, and higher levels to be able to work on site. So it's not every laboratory that is designed to manage samples like COVID-19
like the
samples.
coronavirus. Let me ask you, we've just been having a conversation about safety and protection for those of you on the front line. Yes, you made a point about often the laboratory scientists aren't being considered, but from what you just sort of spelled out, it's very clear that you are also exposed. Is there protection for you? Has there been adequate protection provided for you and your members?
Let me say, currently as leadership, we're moving around the various laboratories to see firsthand what our members are exposed to. For those that are directly working on the COVID samples, we would want to say that as at last week, last 2 weeks, and even now, there are a lot of stations that do not have the PPEs. And I've received a lot of calls, leadership has received a lot of calls. And we are sometimes guided to call other centers that may give them support. What is even more scary as we talk, which we are giving some psychosocial support to our members, is that we believe there are a lot of asymptomatic cases that are coming to our health facilities. And these are being requested to perform laboratory testing. And our members receive these samples not knowing which particular ones are infected and which are not. So to us, we are exposed directly because you need to be able to work on the samples if you are running a full blood count, for instance, or a liver function test. If you look at the results we've gotten so far, we could say about 5% of samples are infected. And if 5% of samples are also getting to our labs that are infected with COVID-19, you can see the scare in the minds of our members.
Yeah.
So to try and psych them up, we've prepared technical documents which we have prepared from our virology and technical team to guide them on how to manage these things, even in the absence of that,
Yeah,
so that
and
they can
just hold on there, because there's something you talked
protect themselves.
about
Yes.
the asymptomatic
Yes.
patients, and that is a key one. I want to bring in Dr. Bernard Abeku Hammond on that. Doc, give me a
Yes.
quick comment on that one, because I see that as a biggest threat for all of you on the front line. A lot of these
Yes.
cases come in, they don't show any symptom, but they may be carrying this virus.
Yes. So yes, as you rightly said, a lot of people will come in without having any symptoms at all. They may come to the hospital for some other complaint. They may even come in accompanying someone else who is also not feeling well. So they just probably patient's relative or something. That's why screening of these patients is important. And Dr. Ba has mentioned it before, pre-Trigen, Trigen systems. But WHO has divided the levels of protection. So you have level 1, what you should protect yourself with, level 2, level 3, what you should protect yourself with. So the role that these personal protective equipment, PPEs, play in this battle against COVID-19 is really crucial. So as doctors in residency, whilst we wait for government to provide, we've also taken it upon ourselves to also solicit for funds to buy and provide for all frontline workers in all the hospitals that we've come. And over the past 48 hours since we embarked on this endeavor, we have been receiving donations of PPEs, cash donations, promises, checks that we intend to purchase and start giving these PPEs out, starting from the designated COVID centers, that's Ghana, Greater Accra Regional Hospital in Accra, and also Tema General Hospital, then gradually move and cover as many places as possible. Because, as you said, as frontline workers, when these people come in, whether they are symptomatic or asymptomatic, we are all at risk, and there shouldn't be any break in the ranks of the frontline workers. So the part that asymptomatic COVID patients who come into the hospital, that part they play should not be underestimated.
Yeah.
And these are the very people who will be going around maybe as carriers, infecting other people, causing a shoot in the number of infected cases that we subsequently record. So we are looking at it very closely.
I'm going to take a break. When I return, I'll talk about insurance for our health workers. And I also asked them policy issues government is grappling with now. Some say to protect everybody else, maybe we need to lock down now, and so we can control what we have. I wonder what their views are on this. We'll also get their views quickly on we've heard the policy about government should sort of do a proper inventory of the mask and the gloves they have, put some away in anticipation of the numbers going up. I'll ask what policies they believe government should be enacting right now to make their work in this war safer. Stay with us. Thank you for staying with us. Tonight we are speaking to our health workers on the front line. They are putting their lives at risk for us all. Remember, when we go to war normally, it's the men with the boots on the ground, the soldiers with their tanks and their guns and their weapons and their planes and etc., etc. This war is being fought by doctors, the nurses, the lab scientists, the doctors in residency, and all the gallant other health workers on the front line. They are fighting this war, and they are fighting an invisible enemy. This is more dangerous than any war we've ever fought in our history. And so we have to spend time to understand what they're going through and see what else the state ourselves, with the taxpayers' funds, can help them do. Dr. Ban, let me bring you in. Before I went for the break, a lot of been said about asymptomatic patients, but I guess that heightens the question about insurance for you.
Yeah.
That has come up. I don't know whether they've given assurances and what is there any special thing happening there?
All right, okay. So just before I come to that, I want to say that we also need to protect frontline health workers. We need to do more training and education. There are some of the health workers who do not even know how to don the full PPE because we are not used to it. We didn't have such things around. And so today like this in Kolaba, we did training for some of the health workers. And people were more confident now to face it. But it's like, okay, if I can wear it, then I'll be able to face it better. So it increases people's confidence. Knowledge is power. So we need to do more training on how to wear the PPE, how to do all of that.
PPE once worn cannot be reused.
Yes, but now you know, because of the situation, we have to reuse some of them.
But what that means is that it has to be properly disinfected once removed.
Exactly.
And there's a whole protocol for removing it.
For removing the PPE. There's a whole protocol.
Are doctors equipped to do that?
Exactly. So that's the training that has to go on. And I must say that it has started.
Okay.
Started? Yes.
Gee.
It has started, but it has to go on. We need to do more training, yes. More training on that. How to wear, how to remove it so that you don't get infected. Because you can wear it very well after doing the procedure. If you don't remove it well, you can contaminate yourself.
It would be absolutely useless.
Exactly. Yes. And then when healthcare workers are on the front line, they get exposed. They have to be isolated or quarantined. Now, when that happens, we usually have a few people who want to be in their homes. That is if you live alone. If you have a family, it's either they move out.
You mean for health workers?
Yes, for health workers. So what we are
Has there been a case where health workers have been quarantined?
Yes. Most of those who have come in contact with the cases are confined and everywhere. What we do is that once you come into contact with somebody who tests positive, then you because of the contact, you have to be quarantined.
How many health workers are in quarantine or doctors are in quarantine now?
I can't tell you the number, but I can tell you there are doctors, nurses, lab people, and everybody in quarantine now. Some of them are doing self-quarantine in their homes, some of them at the centers. But the thing is, we want government to get a place for us, because not everybody will get a single room to be in. And so they should get a place for the health workers. Once they also get quarantined, they should take good care of. Sometimes you even need psychologists to help them.
You're asking for a dedicated place to quarantine health workers
who cannot do that in their homes just because they don't have separate maybe apartments on their own, or their families are there. So they'll be taking it, boosts their morale. It helps them to give up their best to them. But sometimes they leave them on their own, and sometimes some of them get demoralized. And so that's one of the things that we can do for them. Now, with the insurance thing, I know government has said that they are getting insurance for those at the front line. I don't know what that exactly means, but I think that, at the treatment centers, we have doctors, nurses, other health workers, cleaners who are there. And so those people are going to get some insurance package. But I personally think that there should be insurance package for every health worker, because before the thing gets diagnosed, they would have passed through so many other health workers, the nurses at the triage and everybody. So there should be insurance for everybody, but maybe something extra for those who are directly involved at the treatment centers currently.
Okay. I want to bring in Joseph, of course, Krampa with the Nursing and National Midwife Association, who's with us. Just finally, as we wrap up, so what will the nurses and midwives need to help win this war?
Thank you very much. I think Dr. Ban has actually hit the nail on the head. We want the PPEs actually to be in place. We want them. We want them. We want to protect our clients. We want to protect ourselves. We want to protect our families. Aside that insurance package that we are talking about is also very important. Today we had the opportunity to interact with the Minister of Health, where we actually explained to him that we may want our members who actually comes in contact with any of such cases to be actually insured. In other words, there should be a general insurance policy for all of our members who actually become infected, and other, whether you are in the demarcated areas or the centers or wherever in the country, because we are all actually providing health services, which he has actually accepted and said that they will see to it and then implement that one. Okay. Aside that, they are also considering some stipends for actually the nurses and the midwives, the frontline, and other health workers also, and which we appreciate. What we are trying to say here is that from the Minister of Health, he made it clear to us that they've actually imported most of these PPEs, which they've distributed to the regional health directorates. If it is so, we are pleading that they should expedite action on them and quickly distribute them to the centers, to all facilities in the country, so that we can protect ourselves and then protect ourselves well and the public.
And public. I want to quickly,
but not the least.
Good. Yes,
this year is the nurses. This year is the year of the nurse and the midwife. Already we have some perception by the public about us as professionals, which in some ways may not go well with the public.
Yeah, I mean, I would like to take that, but I quickly want to give the final word because of time to Dr. Ignatius, who is with the lab scientist. Just briefly, Doc, sum up for me in a few words what it would take to get your members to fight this war in a confident manner and also take on and boost morale in the front line. Very briefly.
Thank you very much. It will take essentially the provision of the PPEs. It will also take the provision of an insurance package for members. It will require training for members across the country. And I think it will require some psychosocial support for members. I think this is what it will take. We are calling for an escalation of the testing process. That means we need to deploy more people to the front line for testing.
Yeah.
We think that these measures proposed will help our members, 5,000 members across the country, come out boldly and take up the steps.
Dr. Baum, we have 10 seconds.
We're ready to work with all our other health workers.
I'm grateful. We have 10 seconds.
I want to say that apart from everything we've said, the decision by the president to close our borders have yielded much. You could see that if all those people had gone into the community, that would be spread.
Yeah.
Now that we are dealing with the vertical spread, for the horizontal, I am proposing that we should lock down Greater Accra, Ashanti region to keep and then we can protect everybody, including health workers.
Thank you very much. I'm grateful for all of you joining us. Enjoy the rest of your evening.